Dr. Jonathan Craighead, and this is a short video about outpatient shoulder replacement surgery. One of the things that is important for outpatient shoulder replacement surgery is that you identify a friend or family member who will serve as your support system and coach during this process. This individual will bring you home after the surgery and stay with you for a few days while you're recovering. We would like for the individual that you have chosen as your coach to please watch this video with you. The most common reason to have shoulder replacement surgery is poorly controlled shoulder pain caused by arthritis or rotator cuff tearing. Arthritis is the medical term for damage to the cartilage of the joint. Cartilage is tissue that provides the cushion between the bones. Here is an x-ray of a normal shoulder with a nice smooth ball and socket. Contrast that with this x-ray of an arthritic shoulder, in which you see the joint space is gone and there is bone-on-bone contact and large bone spurs. On this x-ray of the shoulder after shoulder replacement surgery, you can see that the artificial joint has replaced the arthritic joint and there is no longer bone-on-bone contact. The surgery takes approximately 1 to 2 hours. During the surgery, we make an incision across the front of your shoulder and use special tools to remove the worn-out ball of your shoulder. We replace both the ball and socket of your shoulder so that now, instead of bone-on-bone, you have a new prosthetic ball and socket that no longer hurt when it's moved. This is an example of a reverse shoulder replacement that uses the prosthesis to reverse the position of the ball and socket. The advantage of a reverse shoulder replacement is that it changes the mechanics of the shoulder so that you no longer need a functioning rotator cuff to lift and use your shoulder. It's important that if you are allergic to any metal, jewelry, or nickel, that you let us know immediately so that we can make sure you have the appropriate implant. The risk of complication from shoulder replacement surgery for healthy individuals is low. The risk of infection is less than 1%. You will be given IV antibiotics during your surgery to help prevent infection. The risk of nerve damage in your arm or hand is less than 1%. The other risk with shoulder replacement surgery is a fracture or dislocation, meaning that the ball pops out of the socket. This is extremely rare as well. Another risk of shoulder replacement surgery is blood clots postoperatively. If you are at high risk for a blood clot or have a history of blood clots, we will place you on a prescription blood thinner for at least 40 days after the surgery. If you do not have any history of blood clots and are not at increased risk for a blood clot, we will ask that you take aspirin for 40 days afterwards. In preparation for your surgery, there are a few things you can do to get your house ready. You want to make sure that there are no loose throw rugs, cords, or clutter on the ground that could potentially trip you. You will likely be more comfortable sleeping propped up for the first several nights. Many people prefer to sleep in a recliner, but if you don't have a recliner, you may want to prop yourself up with pillows. My office will provide you with a shoulder immobilizer that you will need to bring with you on the day of the surgery. You will wear this sling for approximately 1 month after your surgery. You may remove the sling for showers, changing clothes, and gentle range of motion exercises. For the first 2 weeks after surgery, you will not need to do any formal physical therapy. After the surgery, you will have a waterproof dressing covering your shoulder incision. This will stay on until you return to my clinic approximately 2 weeks after your surgery. It is okay to shower with the dressing in place, but do not submerge your shoulder in a pool, lake, or hot tub until cleared by my office to do so. When you return to see us for your follow-up approximately 2 weeks after your surgery, we will arrange for outpatient physical therapy for you. Most patients will do physical therapy twice a week for approximately 6 weeks. Prior to your surgery, we would also like for you to obtain medical clearance from your family physician or cardiologist. It's helpful to have them evaluate you and make sure that you are healthy enough to have the procedure. We also ask that if you have not seen a dentist in the last 6 to 12 months, that you see a dentist and have them check just to make sure there's no infection. An infection in your mouth or gums could potentially cause an infection in your new shoulder. It's helpful to have your doctor and dentist send letters of clearance to my office. After the surgery, we ask that you do not drive until you're off the narcotic pain medicine and have regained normal reflexes. We do not have a set date that you have to return to work, but on average, most people will take off about 1 month. You may ease back into activities and work as you feel safe and comfortable. We do not recommend lifting more than 2 to 5 pounds for the first 3 months after the surgery. We also ask that you avoid any jerky motions or high impact activities with your shoulder for at least 3 months. Approximately 2 to 4 weeks prior to your surgery, we will have you do some lab work. You will be asleep for the surgery, but just prior to the procedure, the anesthesia provider will perform a nerve block to help reduce the joint pain afterwards. Most patients are ready to go home after surgery within 1 to 2 hours. We will make sure that you can safely walk and that your pain is controlled and you are stable prior to letting you leave the surgery center. It's important to have reasonable expectations for your recovery. While the shoulder replacement does immediately get rid of the arthritis, it's normal to have some swelling and pain afterwards. Your pain should be well controlled with the oral medication that we will give you. We will send in your prescriptions to the pharmacy of your choice a few days before your surgery. The surgery should eliminate the arthritic pain, but it will not make you 18 years old again. It is possible to have some occasional soreness or discomfort in the shoulder due to inflammation in the soft tissues like the bursa or tendons. There are additional videos that go into more detail regarding what to expect on the day of surgery and when you go home after the surgery. We would like for you and your coach to watch these videos as well. It's important to us that you feel safe and comfortable throughout this process. If you have any additional questions, please do not hesitate to contact us.